Good evening, everybody. Thanks for joining us for this CMT webinar, Prevention and Self-Care Problems in CMT, which I'm sure many of us are well aware of. And I've had the pleasure of talking with Dr. Stilwell for a little while before this, and I think this is going to be a very interesting use of your time and certainly of mine. As you know, Dr. Stilwell will discuss common foot maladies in people with CMT, shoes, socks, everything that has to go with it. Gait abnormalities will be reviewed along with some over-the-counter stuff, and I've seen some of the slides and pictures. I think it's going to be very informative, and I'm really looking forward to it. So before I ask Dr. Stilwell to begin, I just want to point out on the right side of the screen, you have that toolbar for the GoToWebinar, and you can see there's an area there for questions. So you can ask questions as we go along this evening. We may take them as we go, or we may hold them to the end. There's been a number of questions that have come in before we started tonight's webinar. So we'll see how it goes and see how many we can fit in as we go, and we'll take it from there. And if you need to chat with me directly, there is a chat window there. You can always shoot me a message there also. And with that, I'd like to introduce Dr. Stilwell and enjoy the webinar, everybody. Great.
Well, thank you, Bob. It's really nice that the CMTA puts on these webinars. I'm one of the advisory board members, and the mission here is to try to give the consumer, you all, something that's hopefully helpful. And so this is information that between my own CMT and 30 years of podiatry experience, hopefully there's something in here that would be meaningful to you. Let's see, Dr. Glenn Pfeffer is also an advisory board member, and you might want to check out his webinars on the CMT website as well. This one, I understand, will be archived as well. I purposely did not cover any surgical topics on this presentation. I feel like that's a whole separate talk. And so these are over-the-counter products and do-it-yourself kind of services that you can either discuss with your foot care specialist, or a lot of times a spouse or a family member needs to help you with some of these things when they're in the difficult areas of your foot to look at. But please remember to check in with a licensed healthcare professional like a podiatrist if you suspect any infections, acute injuries, or non-healing sores. Many podiatrists are trained in specialized orthopedic surgeries, as well as biomechanical control like orthotics, braces, and shoes for controlling the Charcot-Marie-Tooth foot. If you're contemplating extensive reconstructive surgery at that point, you're probably best off talking with someone that has documented experience in the CMT foot or ankle surgery arena. Up in the corner, you'll notice this APMA, the American Podiatric Medical Association. They are our national organization that helps to fund research and education. And if your podiatrist is a member of the APMA, typically that indicates some level of achievement and social responsibility. Okay, so when we go to this next slide, shoes. Again, we could do a whole webinar just on shoes, but I find a lot of times these high-top basketball shoes are good at ankle support, and they're relatively inexpensive. They can accommodate various types of orthotics. And I recommend to most people that they say, oh, I always wear a size 9 or whatever. Try one size bigger next time you're at the shoe store and just see what you don't think. By and large, most people like the extra room, and one size bigger isn't going to make them fall off your foot. When you're looking at shoes, there's three main features that if you're at a place like Famous Footwear, one of these discount places, which a lot of us shop at, make sure, first of all, that the shoe does not break in the middle. what I do is grab the shoe, turn it upside down like this one on the left, push the toe against the wall, and make sure that it bends only at the ball of the foot, that there's a flex point across the toe, but not in the arch, never in the arch. So you want that shank or that strong piece to go from the heel all the way up to where the ball of foot bends. And the other thing then at that point is to squeeze the back of the heel, what's called the heel counter, along the sides there, and make sure that those sides are strong. Most of us have a tendency to roll our foot out or too much, or perhaps in too much, but the more stability you can get with the sides of that heel counter, the more it will magnify the effect of your orthotic, your AFO, or even if you're just wearing a soft insole. It's interesting to look at the wear pattern here, that these are actually my shoes. On that one on the left, you can see how there's wear to the outside. That is a left shoe. So the outside, you can see where those nubs are worn off. Those are wedged devices there that are helping to prevent supination or the rolling out of my foot. And so it's funny how simple little things like this is called a rocker bar. Rocker bars are easily put on by most shoe repair people, and you can work with your podiatrist, orthopedic surgeon, physical therapist, orthotist, these kind of people to help get the right amount of wedging or correction. But they work well with AFOs, and there's different heights. So you can see how this one doesn't stick out terribly far, and sometimes that's a little bit of a fudge factor. You may have to go back a couple of times to get it dialed in just right. If you get that bump there, that the rocker bar too high, then of course it can create instability, and you say, gosh, I don't have as much problem with my drop foot. These are quite helpful for drop foot as long as it's not too severe. But you get them too high, then you feel like you're going to fall off on one side or the other. So it takes some finessing, but they can be quite helpful. This next slide is about Atrex shoes. They are one of the company sponsors with the Charcot-Marie-Tooth Association and do a lot of wonderful things for that organization. And they're really one of the leading orthopedic shoe companies out there. You can find them at places like the Walking Company, Nordstrom's, Foot Solutions, these kind of places. I don't recommend that. I think you can buy Atrex on Amazon probably. I don't recommend that unless you know exactly what model you're getting, that you've already bought them at a retail shoe store and you're just ordering a replacement pair. The sizing, as hopefully most people know, is pretty critical. The other thing is these Atrex shoes come with an insole in them, and some may be able to just start off with that. Most of us have to remove that insole and then put your AFO or your own custom orthotic in there. Which brings up our next slide. When you go to the, like this picture was from a Rite Aid, it's overwhelming when you go to Walmart or these kind of places at the maze of insoles, orthotics, gel inserts, that one that says it's a custom orthotic. I mean, obviously not a custom orthotic. The insoles like this, if basically all you have is a rigid foot type, then you may be able to get away with like that pink one there, that the something gel that's cushioning, and not have to spend a lot of money on a custom orthotic. If you're buying the less expensive shoes at those discount places, at the very least, take their stock sock liner out, a little insole that comes with the shoe, and replace it with something like this. So they're not expensive and can make a big difference, at least how the shock absorption is. With AFOs, I'm finding that there's a fair number of people that never get any kind of modification to that foot plate, that hard piece that sits down inside the shoe. You can certainly put one of these gel insoles on top of it and give yourself a little more of a softer interface between the hard brace and the foot itself. So custom orthotics are ones that are actually made from a plaster cast, laser scan, something like that, where a laboratory actually either makes them from a three-dimensional printer a 3D printer or by hand. And whether it's over the counter or custom, a lot of times these devices need further modification after you've worn them a while. So don't feel like it's right out of the box and it's always going to be perfect. Let's see, what else? The team approach, yeah, you know, if you can get in, and that's why I love the whole idea of the CMT Centers of Excellence, where you have an orthotist, physical therapist. I wish they'd get a shoe repairman and a podiatrist in the Centers of Excellence, then I think it could be very good. But shoes play an important role in getting the orthotics to fit. It's rarely one or the other. They have to be in cooperation. The other thing that I'm seeing is a lot of Charcot-Marie-Tooth patients with what we call accommodative or soft type orthotics. These can be custom made from a mold, but they last a very short time, 1 to 2 months tops. And I'll see people that have been using them for 6 months, a year, 6 years, whatever, and they're just smashed all to heck. And so that's kind of the rub, is the rigid materials, the harder plastics, like you see on the bottom of these extreme gel insoles here. That plastic takes forever to wear out, or maybe it never wears out, I don't know, but it also means that it doesn't forgive if you have a sore spot, a callus, if it's pushing you the wrong way, those kind of things. So most podiatrists will use a combination orthotic where you have some part of a rigid shell to give you some control, whether it be in an AFO or just a foot orthotic. In case there's people that don't know, AFO is ankle foot orthosis, that kind of comes up the leg and usually has some straps to keep a rigid brace, a rigid upright, either on one side or both sides of your calf to give yourself even more control than what you can get from just a shoe and an orthotic shoe. Starting to really crank on the way that the ankles work. All right, so next slide. This is, the disclaimer is that I am the patent holder for this device, but it's kind of a novel idea from the standpoint of this self-adherent silicone was used in wound care, and it still is. And so we found that this type of device can provide a lot of support without taking up a lot of room in the shoe. So if you are wearing a shoe that's marginally too tight and you have to also squeeze an AFO in there, this may be a good option for you, just to take some of the pressure off. The location of these things is pretty critical. That's why normally we try to only sell them to podiatrist's office, those kind of things, so that there's someone trained there that can actually show you how they go on and make sure you get them on there correctly. And these are my wife's feet, actually, and she doesn't have CMT like me, but her devices are about 5 years old and they're looking a little ragged, but it's an interesting way to get better correction. So the next slide, Bob, please. This is another podiatrist invention. Dr. Ray McClanahan in Portland, Oregon has this company called Correct Toes, and it was based on the idea for yoga toes. And you're probably familiar with the way pedicurists will use those foam spreaders when they're painting their toenails. And within the foot and the hand, there's what we call intrinsic muscles that help to spread the toes apart, spread the fingers apart. And in CMT, that's one of the first muscles, as you probably know, to go, that you lose that ability to open and spread those toes. And there's some research showing that by keeping the toes spread apart for a period of hours through the day, that this may help to stimulate the muscles. You know, as we know, that any way we can do to keep the muscles strong as long as possible, the better we're going to be when we're walking. I wear mine with sandals. I tried wearing them in the pool, actually. They work great in the pool. The only problem is that I slipped, the one pair slipped out, and I don't know where it is. It never turned up in the pool filter, so I had to reorder another set of these for my left foot. These things work very well. Again, just to caution you that if you do get on their website and order these things, use them only about an hour the first day or 30 minutes. and gradually work up to it. Toes, or most people's toes, are not used to being spread apart this far. That you can see it's somewhat gentle, but we gotta go slow. All right, so now let's talk about socks. You know, we look for varying densities or thicknesses to help to protect your toe sores, calluses. Also helps with heat management, whether it's winter and you're trying to keep them warm, or summer you're trying to keep them cool. These wicking materials help a lot with not only moisture management, but with neuropathy, like CMT neuropathy. A lot of people will say their feet maybe feel cold or they feel hot, or will alternate. And so the more we can use these fibers that help to mitigate some of those changes that the nerves are trying to do on us, that it makes it more comfortable. One of the best indulgences I can recommend, frankly, with socks is to change them after 6 or 8 hours wearing them. You know, put them on first thing in the morning, and then if you get a chance, you know, 4 or 5 o'clock in the afternoon, put on a fresh pair of socks. My gosh, what a delight. And as far as buying these things, you know, some of these brands are pretty pricey. So this is one place, frankly, yeah, where I would shop for them on an online retailer. Even still, you're looking at probably $12, $15 a pair, this kind of thing. But I think it's an investment well worth it. The next slide talks about swelling, in the sense that, my brother that has CMT is flying to Africa this month, and has support hosts to prevent DVT, or deep vein thrombosis. A blood clot in your leg can form if you're seated for a long period of time, like in an airplane. Knee-high can act like a tourniquet. See the way they have that thick band at the top there? That's to kind of temper or mitigate some of the constriction at the top. That's why if you have very much swelling, if you have chronic lymphedema, these kind of things, maybe a congestive heart failure issue, these kind of things where your legs swell more, you may need to have a higher mid-thigh or these kind of things. How to tell when you need support hose? Do your regular socks, ankle-high socks, let's say, leave a little ring around your ankle or lower calf? If so, then you might want to consider, again, these are online. Dr. Comfort is a brand I like. They support education and provide a lot of foot health information. And so check it out and see that they made a lot of good progress with the fibers in these things. And this picture, if you're wondering, is not my legs. The next picture, though, we'll talk about nail clippers. And I think that the more basic question is here is who's going to trim your toenails? You know, how flexible are you really? And is your eyesight an issue? Or, you know, I mean, most of us have some hand issues with CMT also. So that figures into it. If toenails are relatively normal, you know, you could probably use the same clipper for your toenails that you use on your fingernails. I have a pair of these ones that are all metal ones, like in that bottom row, and I dip that little top lever in some of that liquid rubber so it wouldn't go flying out of my hands if it's slick or wet or whatever. And so that gives you more traction. You can see you have the one on the far right and the far left there that have a little turquoise and white rubber. Those may be more ergonomic. They do encourage you to cut the nail straight across, which is typically what you'll see recommended as far as how to shape the toenail when you cut it. You can get into problems and you go digging around the corners of those things because you can leave a splinter down in the side. Let's look at this next picture, Bob. These, I call it heavy hitters. I mean, you can do some serious damage with these things, but probably best used by some kind of a caregiver. Now, I'm not saying necessarily you need to go pay big dollars for a medical pedicure, but perhaps someone that has had a little bit of hygiene training at least that could help you trim with these things. If you have big, thick toenails, it sure can be great. If you're going to do it on your own feet, obviously be careful. It's fine, you know, for isolated nail deformities. You have one little bump on one toe that got something dropped on it 10 years ago. Probably okay to use one of these things. But the bigger the nipper, the bigger the damage they can inflict, right? Okay, so the next slide, we're back to Rite Aid here, and there's no, you know, this could be Walgreens or Walmart, whatever. I just was in the neighborhood and thought I'd take some pictures. Hopefully not get thrown in jail for taking these pictures. But anyway, these heavy-duty nippers, sometimes these are actually better for fingernails. But if you can use them on your toenails, this is what the professionals use. Are these kind of things? Just make sure they're stainless steel, not that chrome stuff. You'll find a lot of the cheaper stuff. This one, and the second from the left on the bottom row, what they call barrel spring, those tend to wear out quickly and are not. I mean, of course, at 14 bucks, I guess you're not out a lot of money, but you want one that has more of a spring kind of thing, like that one in the middle, that the blue and white handle. These cuticle remover tools, these things on the lower right, I do not recommend you use use them for a craft project or something like that, but please don't use them on your body because they can be dangerous, especially in the presence of neuropathy. So you may not feel that you're damaging yourself. Top left, the scissors there, I would recommend you use those things only for cutting. You know, you've got a fiber loose on your shoe, or you want to cut off a little bit off the side of the insole that's in there, but not recommended to use scissors on skin or toenails. This next slide, if you look at, there's two main types of these jawed instruments. This is just for soft tissue. This is great if you have loose or hanging skin. You can carefully trim your cuticle. Maybe you have some dead fungus skin hanging, or a little bit of a dry skin where it's just built up and you can snip a tiny bit off. That's all great. Clean these instruments with soap and water, and then use a little rubbing alcohol on them and let them dry. And that way they should be fine to keep reusing and shouldn't cause you any self-infection problem. Our next picture,
hey, Greg, before we jump forward, I have a question here about the pedicures. Somebody's curious, like, where would you inquire about a medical pedicure?
You know, if you call the podiatrist offices, a lot of times either they'll have a person in their office that does one, or they're have an association with a nail salon that does these things. The main thing you want to look for is, if you go to a salon, is that they have an autoclave, the actual steam sterilization process to clean these instruments. And you know, that they're using gloves and they disinfect your feet. And the whirlpools, you know, we stopped using whirlpools because of the risk of transmission of disease in that water that they just can't get out of the pump in between clients. So if you're going to soak the feet, it's best to just soak them in a basin that they can thoroughly disinfect. Does that make sense?
Yeah, I think that answers the question. Thank you.
Okay, so wound care. All right, you have your shoes and socks off, and you know you bang your toe on something. These are simple scrapes, you know, mild cuts, not infected. You know, I'm doing all these disclaimers, right? But just a little mild scrape like that, frankly, is probably best treated with one of these herbal creams like arnica or calendula. If you've never heard of these things, that you get them at a health food store. Whole Foods has them in their supplement aisle. Arnica's A-R-N-I-C-A. It's a plant, and they use the root, and it's quite effective at healing little minor sores. Calendula is a flower, C-A-L-E-N-D-U-L-A, and so these are very helpful but relatively benign. issues, you know, with things like that Neosporin that you're seeing on the left there. There's some question about, are we using too many antibiotics? You know, are we creating antibiotic resistance by spraying triple antibiotic spray on everything that looks like it might need it? So most antibiotics, soaps, creams, these kind of things are probably not necessary. I saw one at Bed Bath & Beyond. It was a scented antibiotic soap like you're supposed to use in your delicate powder room. Why does it need to be antibiotic? Doctors use antibiotic soaps and antibiotic creams, but these are usually specific types of prescription drugs for specific bacterial organisms. These broad spectrum things like this are probably not what you want to use. Okay, so the next picture, please. This Hibiclens, again, this was a surgical scrub. It was outlawed for a while for kid use because chronic use can cause neurological damage. So again, if you take some and you wipe it on a piece of gauze and dab it on your toe once, it's going to be fine. But these over-the-counter antiseptics like this, I think, are way overused. And you can buy just a plain saline wound wash, whether it be a liquid that you pour on a piece of gauze, or they have these spray cans that you may have seen that are really great for flushing out you know, you fall on a curb and scrape your knee up, you spray some of that saline on your knee, and that's probably one of the best ways to get the healing to jump start. Okay, let's go to that next slide. So foot soaps are controversial for wound care. So if you're having an ingrown toenail, you have a little blister that's slow to heal, these kind of things, probably best if you like soaking to use something like an Epsom Salts. Soaps are classically used more as a muscle relaxer and pain reducer. Magnesium salts, again, when you read, you know, there's 4 or 5 boxes of different kinds of foot soaps you can get at the local pharmacy, and look for magnesium. I would avoid anything with aluminum in it, just because of the potential that aluminum can cause nerve damage. Apparently, it's been associated with Alzheimer's and these kind of things. So I'm not sure I want to be soaking my feet in aluminum-based products. You can also make your own foot soaks if you have any kind of an herbal store near you. Gosh, there's all kinds of beautiful plants and flowers and these kind of things that you can put into a basin of water, and can be quite healing and soothing. All right, let's go to that next one, please. Moisture balance is always the key to healing. And the old adage in dermatology is you wet a dry wound or you dry a wet wound. So if it's too wet, you dry it. And so the idea is that these tapes are supposed to allow the ideal amount of moisture balance. I would avoid plastic Band-Aids, these what they call occlusive dressings that have a lot of moisture holding capabilities. They have their place in the dry wound. And again, this is why if it doesn't look like it's healing after a couple of days, you probably ought to go see your podiatrist and find out what's going on. Okay, next picture, please.
Just real quick, Greg, we have a question here about if someone has CMT, do you think they're more at risk of having infections on their fingers and toes because of the CMT, or?
Well, that they're more at risk because of the potential for having an injury and not feeling it. You know, similar to diabetes, where people get, well, like on this picture now, that where you see that somebody's taken a razor blade and shaved off part of that callus on the big toe there on the left. I mean, the little red spots there are bleeding that has happened within the skin. Well, a lot of times people say, well, I didn't really feel it, I just thought it looked bad. Well, so between that there are circulatory issues that are associated with CMT. I don't know that they're directly caused by the Charcot-Marie-Tooth, but again, it seems like a lot of people with CMT also have marginal circulation. So I think the answer ends up to yes. I think CMT patients are more susceptible to foot infections.
Thank you.
This fungus is one of those things that is ubiquitous. A lot of these studies have shown that you can culture fungus on so-called healthy skin. So I think it must be Mother Nature's part of the normal flora that exists on everyone's feet. It's just environmental conditions, socks, shoes, working in a moist environment, these kind of things that can really get fungus to cranking away quickly. Now, again, just like we talked about with the diabetes, circulatory problems, as well as the CMT, you see fungus infections more often than you do in the rest of the population. And is that because they're jammed into these shoes with an AFO and I don't know, but I suspect it also has something to do with the disease process itself. On this next slide, if your nails are already thick and damaged, or the whole nail is yellow, then I would start treatment with a podiatrist first. And I don't know what happened to the picture on that one.
Yeah, I'm not sure. I'm not seeing the image here either, so I apologize.
Picture out by it must have been censored because it was just too gross. It had a picture of some really nasty toenails, and I think somebody took them out. But anyway, that the over-the-counter medications only work on really the early or limited involvement fungal infection, where one corner of your big toenail kind of has a yellowish or a greenish tinge to it. But sorry, that was on my end. So let's go to that next slide there. So, a lot of these products, you see the undesiclinic acid, for example, that the one on the right, that the antifungal pen, these are kind of novel ideas, and used to be that that's what podiatrists would use with these kind of things. And you'll still see it in some of the older practitioners' offices, but by and large, they've been replaced by much more effective, usually prescription strength medications. But this is where, again, you talk about a medical pedicure. You may not be able to find somebody who's actually trained by a podiatrist as a medical pedicurist, but typically that there are these wonderful manicurists, pedicurists who sometimes have a particular interest in treating people with toenail issues, and it can be a real lifesaver, because initially you want to be seeing them every 3 or 4 weeks to get them ground down and trimmed back thoroughly, and then when you're putting the medication on, this stuff's actually going to soak in. These fungus nails become very porous, and you have to grind off the top layer to open up the sponge of the nail so it will absorb this medicine. Otherwise, it has a tendency to sit on top and not do much. We got one more toenail fungus slide here, Bob. So most of these really work best at preventing reinfection. So let's say you go to your podiatrist and have laser treatment on your toenails. That sterilizes the nail. That kills all the fungus in the nail, at least until it comes back. So again, because fungus lives in everybody's skin, and we may not be 100% controlling the environment where the fungus likes to live, the dark, warm, moist environment like inside a shoe. But these can be helpful to keep the fungus from coming back, but they might not, or probably are not, strong enough to kill the fungus by itself, unless you're a real ace at getting those nails trimmed down yourself. But as your podiatrist, the dermatologists talk a lot about how a high percentage of these ugly nails are not fungus, and with the advanced lab work that's available now, you can send a little piece of the nail off to these specialized toenail laboratories that do nothing but fungus. And they do these really amazing tests that can pick up much more sensitively than we used to have, and tell you whether or not it is fungus. And most of them are fungus, has been my experience. Okay, next we'll go on to athlete foot. Oh, I'm sorry.
Greg, before we move on there, we have a question somebody's asking about. What about Vicks or Listerine? Kind of over the counter.
You know, again, that probably not strong enough to kill a fungus infection, but you know, it does create a nice acid environment that the fungus does not like, and so it's not going to hurt you. And you know, there's certainly been testimonials, people saying they put Vicks Vapor Rub on their toenails and it cleared them up, and so it does help again with that environment to keep everything working better. What I wanted to point out on this one was that the most products for nails will also work on skin, but not vice versa. So over there on the right, that Lotrimin Ultra is for skin, but it won't work on toenails. And so if you're not sure whether or not you have fungus, again, this is where it's probably best to see a professional. And in the dry climates, we see kind of a dry, scaly rash that is around the outer soles of the feet. That's fungus. And then in the wetter climates, at the higher humidity areas, you'll see most of the fungus between the toes. More of a redness, kind of get some toe jam, I think they call it, and odor sometimes too. And so those can be treated a lot of times with these over-the-counter things like Lotrimin. Okay, so let's go to this next slide. And these acids work too well. You know, sometimes it's difficult to differentiate, frankly, you know, even physicians between a wart and a callus, and they are totally treated differently. So this is why, first of all, that you know, you're already making your own diagnosis, and maybe it's not a wart at all. You're like, well, what else could it be on the bottom of my foot? Well, it could be a callus. And for a callus that is caused by an underlying bony deformity, where wart treatment usually you can laser it, you can cut it out, freeze it. There are acids, but again, that these things, when the presence of neuropathy, are probably not a good thing. Let's go to this next slide, please. I would only use these types of pads with a doctor's recommendation and have them give you usage guidelines and check back with your physician on a regular basis. Many infections, ulcers, cellulitis, you know, damage to your skin are caused by these products. So, you know, probably in the healthy population without neuropathy, you know, I think this is why the FDA leaves them on the market. But go to the next slide, and see that even this one, you know, it's like, oh, gee, it's just extra soft cushioning. How pretty. But then, meanwhile, read the label. Salicylic acid, when you put it under a bandage on your skin for 12 hours, it eats through some pretty healthy skin, even on someone that doesn't have CMT. This next slide, the freeze away there on the left, again, you know, we don't know what your sensation, what, you know, level of damage your nerves in your feet may have had, where one person can use that freezer and can tell that, okay, that's getting a little too deep and it's uncomfortable, and the next person can't feel it, you freeze it clear down to who knows what level. So if a product like this says it is not recommended for diabetics, that also applies to CMT, because it's similar as far as the danger because of the neuropathy. On the next page, there's our picture. These neuropathy creams have become more mainstream. They used to be the exclusive domain of you know, the Whole Foods or the local herb store, these kind of things. They can work. They're quite effective. Most of them that first came out had capsaicin or chili pepper cream in them, and those ones are what they call a counter irritant. I probably would stay away from those. you don't wash your hands right, you get that hot pepper in your eye or somewhere else that's tender and delicate, and it's not fun. But these creams like this are really first line of treatment. When I've talked to my colleagues in Latin America, Europe, these kind of things, that this is one of their first line of treatment, is to have CMT patient start with this kind of thing. So give it a try if you have pins and needles, stabbing pain, just that weird nerve pain thing. Next page, please. These oils and creams help to keep your skin healthier. The emolliency, it's called, of the skin is really important to prevent breakdown of the skin. Dry skin is fragile skin, and your AFO happens to be rubbing your ankle wrong. You got a new shoe that's too tight and it's rubbing your bunion or whatever. If that skin has enough elasticity to it, it can withstand a little bit of rubbing. But I like using these oils on my feet every day. Put them on in the morning before I put my socks on. On the next slide, this again is one of these mainstream things. You can see the little seal of approval down the lower left there by the American Podiatric Medical Association. Again, that there's a lot of heel balms and these kind of things that are made from all natural things without a lot of the parabens and some of the preservatives that potentially could cause irritation of your skin. And then on the next slide, these are a fairly new device on the market, and it's a low RPM. That drum doesn't spin all that fast, but it has a lot of torque, a lot of strength, and so you can set it on callus, a toenail, those kind of things, and it's one of the best inventions I've seen. And I'm sure you could still hurt yourself with it, but it's pretty good. So I would recommend that. It's available at the retailers and online, these kind of things. Let's do the next slide, please, Bob. See, this is one I thought they were going to take out. The so-called dry skin scales that you see around the toenails there up on the top, that's probably fungus, actually. So most of these things, it's the same fungus that has gotten into those toenails and made them kind of the horns like that. And the skin can clear pretty quickly. You put that Lotrimin on there twice a day for a week, and the skin will look like brand new. Those nails are going to take longer, obviously. This is, again, where things like biotin, B-I-O-T-I-N, it's a B vitamin that can help the nails to grow stronger and faster. They work well. These kind of oral supplements, you take the herbs by mouth, that will make the toenail treatment much more effective, along with the topical medicine. Okay, let's go to that next one, please.
I have a quick question for you here, Greg. Someone just says, and probably mispronouncing this, so excuse me. Is CMT a cause of petechiae on the ankles, and what would be the treatment for that?
That's a cause of what on the ankles?
It looks like petechiae, or P-E-T-E-C-H-I-A-E.
I'm sorry, I still can't hear the.
Okay, we'll move on for now, and then we can come back to this. So I'll go to the next slide here.
Okay, yeah, because I'd be interested in talking about that. Heel cracks. This is a relatively mild heel crack here, but if you get one that's trying to really open up on you, super glue 1 tiny drop. Wear gloves or have Kleenex so your fingers don't get glued to your heel, but 1 drop and squeeze that crack together, and that will work pretty well. I recommend really that first what you do is a half hour or so beforehand is wash it, dry it, and then once it's nice and dry and clean, then glue those edges together, because it'll stay glued together for about a week or so, and that should be long enough to get that crack to heal up. Okay, next thing. A lot of us have these hammer toes, varying degrees of crooked toes, where they want to take pressure too much on the tips. And these buttress pads are these little fillers that go underneath there. There's ones that are all silicone like this one. There's cloth ones, various types. And You can get these over the counter. You can get them on Amazon. There's a place called Dr. Jill's Footpads. You can get those online as well, but they're really quite nice at preventing calluses, corns, and even pressure ulcers on the tip of your toe. That next slide. These things come pre-cut, but usually what you want to do is take and cut a little, a little wedge out of the bottom of the sleeve, so that as it sets back, like this picture on the left there, where the big toe has the foam all the way down into the what's called the web space there at the bottom of the toes. You can take a little notch out of there, and then it'll help it sit a little better without, sometimes those have a tendency to cause irritation down in that delicate web space. And then let's go to that next slide. These things work well as a rehab device. Talk to your physical therapist or podiatrist. If your toes are turning under, you're trying to get a bunion, whatever, that you can rehab your muscles with this. This picture, the before and after, is probably a little overly dramatic, but they work great after surgery. Walking in them will break that plastic, so it's something you put on either at night to wear while you sleep, or you put it on for 15 minutes while you're doing your bunion exercises, and then take it off. Okay, so Callus 101. This is where that rotary grinder works well, that one we saw a picture a few slides back. This again may be a place where you want to have your podiatrist or orthopedic surgeon, these kind of people, recommend a custom orthotic that can actually take the weight off of that spot, because here this gentleman is bearing too much weight. You can see the big toe too has a callus on the side, and so we should be able to get the pressure off there. And speaking of which, the next slide. A circle pad like this placed over a sore spot will actually make that sore spot stick out more, because it sticks out through the hole, and it potentially could be even more prominent. So that's why we recommend that you cut them into a horseshoe. Put the open end of the horseshoe forward, facing towards the toes. The pressure on these bony prominences comes from behind, from the heel or ankle direction. So build it up on the back side. On the next picture, you can build up multiple layers. Again, this is where a nice sharp pair of scissors, or again, depending on how agile your hands are at this point, that you can draw on there what you think you need. And we'll use actually a lipstick. My wife loaned me one lipstick that she's not using anymore. You can actually draw that around the sore spot, and then lay the non-sticky side of that moleskin on that lipstick, so it transfers through, or transfers onto the moleskin, and then you'll have a template on which to cut your little pad out. And make sure that you take this stuff off every day, especially if you get it wet. You don't want fungus growing underneath these pads. And make sure you get all the adhesive off, some soap and water, maybe a washcloth. All right, that next slide. This is a very temporary, but but effective treatment. It's you're going out for the night, wearing your this is obviously a lady's foot. You're wearing your dressy shoes to an event that hurts that bunion. This will give you a couple hours of relief, and then they're pretty well done. But at least that's a nice way to do a home remedy. And again, see how she's got the open part pointing towards the toe. She took the piece out of that circle pad and stuck it behind that bump. So now she's got double the thickness right behind it, where that shoe's most likely to create the pressure from behind anyway. All right, next slide, please. So the back of the heel is prone to these things that we call pump bumps. We used to think that it would only happen in ladies that wore high-heeled shoes, but a lot of people have a little enlarged bump on the back of the heel there, maybe their Achilles tendon gets sore. And it's amazing how just a single layer of moleskin like this will provide a lot of nice relief. You might also look at topical pain relievers for these kind of conditions. There's a product called BioFreeze, B-I-O-F-R-E-E-Z-E, that I think is available on these various online retailers. And put that on at night. It's kind of a menthol thing that's got some other pain relieving herbs in it. And you can't use it before you put the moleskin on because the moleskin won't stick. But it builds up over time if you use it a couple of times in the evening and over several days usage. So that BioFreeze can also help to reduce the inflammation. And then your heel pad's going to work even better. The self-adhesive silicones, Dr. Scholl's are making some of these kind of things that are similar to Barefoot Orthotic, where you wash them and stick them back on. Okay, next page, please. I think the more we can do to exercise our feet, the better. Pulling the toes apart like this can be helpful. You can also grab the big toe with your right hand, the second toe with your left hand, and bend them away from each other, get them to spread apart, down and up, and circle them and these kind of things, and then go to the second and third toes and on down the line. And when you get all 10 toes done, typically you'll find that there's a little pleasant tingling sensation in your feet. The CMT website also has some other resources about foot exercises. There's a nice webinar on there done as well. Well, then the next slide is basically just a summary of who I am. I'd be welcome to emailing with you all if you have specific questions. Please feel free to type in some questions if you have them this evening. And that next page, just some, this will be on the CMT website. Be fun if you want to check out our blog. We have tips on exercise and some other fun topics. My son, Dr. Dan Stilwell, is also a podiatrist, and so he and I write that, Dr. Soul Brothers. All right, well, let's go to the questions, Bob.
All right, well, thank you very much. We have a few here from this evening, and as you know, a bunch that we've gotten before. So let me start with that question I did not pronounce correctly before, and it was petechiae. And
petechiae. Yeah, petechiae are little blood vessels, and so what I suspect that this person is asking about is with venous stasis. If you have swelling, if you have issues where the blood is not returning up the leg well, you can get a chronic redness in the ankle and lower leg. And again, that's probably best treated with, or they have creams. Horse chestnut is a common one that you'll find, and then the support hose. There's some prescription creams also that work well for the petechiae. Are they more common in CMT? You know, probably more than the average population, simply because a lot of us use AFOs. A lot of us have a little foot swelling, which are all causative factors for those kind of conditions.
All right, so we have a question that came up earlier about the correct toes device, and is that something you can wear to bed, or can you sleep in that?
You know, I wore mine to bed once. I actually forgot I had them on, and I woke up about midnight and tore the things off because they were hurting my toes so bad. There's probably people that could wear them all night. This is why I was saying that it's a great little device, but gosh, start slow and you know, take them off after half an hour first time you wear them, and if you can't see your toes well, you can't use a mirror to see your toes well, have somebody look at them and make sure they're not pushing too hard, because a lot of our toes are kind of rigid, and to start pushing them around like that, even though it's a relatively forgiving silicone product, it And I had one the other day where it caused a pretty deep crease in my toe, and I thought, uh-oh, I hope that doesn't break the skin down.
Okay. So it sounds like it's up to the individual, and go slow is the best advice there.
Right.
Here's a question, and this one is always, because I wear braces myself, and I'm always interested to hear the opinions on this. Does wearing ankle braces cause your muscles to become even weaker?
You know, the short answer is possibly. But here's the rub. If your gait is more normal because you're wearing this really sweet AFO that somebody designed, so now you walk almost like a normal person, then, you know, probably those muscles are functioning better. My thought is try not to wear your brace all the time. If you can find, okay, gosh, I go to the gym, I ride the stationary bike, I take my AFOs off because I want all those muscles to have the liberty to fire and do whatever they can during that activity. And but then there's times, you know, you're hiking up in the forest, well, you probably don't want to fall, so you want to wear your brace. And then if you can, again, get involved with a regular exercise program of some sort that emphasizes those ankle muscles, then I don't really think it's going to be an issue. I think the net gain is probably in favor of wearing the braces over the worry of it becoming weaker. I think in the past, a lot of patients were told to wear their polypropylene AFOs, you know, till the time they got up, till the time they went to bed, and no thought about exercise or, you know, who cares about muscle weakness? You already have muscle weakness. And so thankfully our thinking is evolving towards trying to maintain that strength. Is that helpful?
I think that probably answers the question very well. We have a question here from someone who says that they something called, well, they're calling them the shocks, about once every 6 to 8 weeks or so. And it's a pain that being represented as like a lightning bolt shooting about an inch or so somewhere on the foot, usually just 1 foot at a time. Started about 10 years ago, but has slowly moved up their foot. So they're curious if you have any thoughts on what causes it, any way to prevent it or alleviate pain.
Yeah, these are very common. If you're a member of any of the Facebook groups for CMT, that kind of thing, you'll see that there's a lot of people that have these things, and some people have them every day. And so the treatment I've found most effective tends to be along the line of this, what some people call the alternative health system, things like acupuncture, massage, herbal supplements directed towards nerve function. There's electrical stimulation. There's what I call the TENS unit. There's impulses you can direct into your legs. There's a pretty nice product called NeuroStim out, NEUROSTIM. It's a product that has to be done in a doctor's office because it's kind of expensive and takes half an hour. But these things help amazingly with these shocks, with these nerve impulses. And I try to get all my people that have CMT to see a licensed naturopath or what's called an ND. You know, the medical doctors, and this is called a naturopathic doctor. They go to a 4-year naturopathic school, and basically they learn about diet and nutrition, and can be a wonderful complement to the great work that's being done by the neurologists and the surgeons and these kind of people.
Okay. So moving on, a little bit of a follow-up to that. I have someone who is very active on their feet most of the day, does their work standing up, and gets very tired after walking a lot, and worsens their foot drop, etc. And is curious about maybe using something like an electric impulse device or a walking aid as necessary. And just kind of looking for an opinion on those sorts of treatments.
Yeah, this is a really hot area of research right now as far as the electrical stimulation of muscles. I read an article today where a man had a spinal cord injury, and they were able to create these computers that could take the brain impulses and actually make his leg muscles activate so he could walk again. So that I know with Charcot-Marie-Tooth, we have a thing called a heel switch that a lot of the physical therapists use, the occupational therapists. It's a little electrode in the bottom of the heel of your shoe, so when you contact the ground with your heel, it fires an electrical impulse into the front of your calf where the anterior tibial muscle is, and it will slow down the foot drop. This assumes that the muscle is not totally atrophied, but if there's muscle there, that you can stimulate it. Just because the nerve to that muscle isn't working all that well because of the CMT, hopefully there's enough muscle there you can kind of reroute around the diseased nerve and stimulate the muscle externally with this electronic switch. You know, I think too that there's a lot to be said for just working with the various centers of excellence on these kind of problems. So I don't know that, you know, it's kind of a complex question, and I'm trying to make a simple answer, but tell me if you think that makes sense, or if that is helpful, or was there some part of that question that I didn't answer?
I think we got that well. And we have a number of other questions still here. I know it's 9 o'clock. If you're willing to stay on a bit longer, we can probably get through some of these.
Well, that would be fine with me. I don't want to keep the people that are on the line, but yeah, let's see if we can get a couple more of these knocked out.
It looks like the crowd is hanging in there, so let's go through these in a bit. Are people with CMT and foot problems more likely to have restless legs?
You know, restless leg is considered a neurological diagnosis, and you know, my personal opinion is yes. It seems like that you'll see these groupings of neurological conditions like that, and thankfully a lot of the treatments for restless legs also can help with CMT, shooting pain at the shocks, I think that other person called it.
Okay, and so now we have a few questions here that came in this evening while you were speaking about if you can make any recommendations for types of braces and or when to get surgery. What's the proper time? When do you recommend somebody go see an orthopedist? Do you have any time that you say, you know, you see a specific piece, or when you say, well, that's an orthotist or that's an orthopedic?
You know, it's kind of a sequential fashion in the sense that if your drop foot isn't too bad, that may be able to be managed totally with the rocker bar on your shoe. Maybe you really have minimal to no drop foot, and all you need is something inside the shoe, just a foot orthotic. If you have a lot of deformity, that your heel turns under, your ankle bone looks like it's ready to shoot for the ground, then you probably need an AFO. The AFOs pretty much are all made out of carbon fiber today. I think there's maybe some people still use the old-fashioned white plastic, that polypropylene stuff, but not recommended. If you've tried all that stuff and still having issues, that's when you start thinking about surgery. Surgery is one of those things where it's a collaboration, obviously, between the surgeon, the patient, the family. You want to make sure you've tried all your conservative care, and you know, this is assuming it's more of a chronic problem as opposed to an acute problem. You know, people ask me about, well, should I have surgery? And it's like, well, what do you have problems with? And if it's something you've been bothered with for quite a while and it just won't go away, then a lot of times there are simple surgeries that can make a world of difference. The things like flexible hammer toes, that these toes that are crooked but aren't rigidly crooked, a lot of times can be treated right in the office with minimal downtime. People that need more extensive tendon transfers, reconstruction, lots of bone cutting and internal hardware, external hardware, screws, plates, rods, these kind of things, that's where you want to make sure that your surgeon has had CMT experience.
All right, thank you. I have a question here from someone who has saying both of their big toes are turned so that they walk on their sides, their feet on their sides, basically. It's causing nails to crease along the side and dig into the flesh, and getting some swelling and redness on both sides of the big toenails. And so they want to know if GP is saying toes aren't too bad and to just soak them in Epsom salts twice a day. And do you think there's any other advice you give them about that?
I like soaking, but remember that Epsom salts are a drying agent, and so if the that can be good if it's in the toenail and the toenail's getting kind of infection, red, whatever. Then sure, you want to use the drying agent like the Epsom salts. But otherwise, use those borax soaps. Go get your the flower type remedy foot soaps, because those help to condition the skin. That will make the skin tougher and more elastic. You can use those cylinder cushions like we saw in the one slide, the little either silicone or foam rubber cylinders you pull on over your toe. That can be helpful. Again, the socks. I see a lot of people that wear these thin little socks and then complain that their calluses hurt. Those thicker socks don't take up really much more room in your shoe and make a world of difference. You can use those arnica and calendula creams that we talked about. Those kind of things act as a what we call a prophylactic cream, meaning that it just helps to prevent breakdown or infection. And then push comes to shove that there is surgery, obviously, that you can do to straighten those toes out, make them lay flat.
All right, so we have several questions here about foot pain and the best way to go about treating foot pain. I guess I'll turn that over to you. I know it's probably a very broad question, but there's a number of different people with different types of foot pain. I'm wondering, what's the best remedy? How do they manage that?
I think that is a hugely broad topic because, first of all, pain is divided, and from a clinician standpoint, we say, well, is it a chronic pain or is it an acute pain? And so I'm going to say for now, let's talk about the chronic pain that a lot of people with CMT have. Now, again, is it caused by a callus? Is it a crooked toe? Is it because their ankle's so crooked that it's making their knee hurt? A lot of us get pain at night in our muscles, and these magnesium lotions can be great for rubbing on there before you go to bed to help with both restless legs and calf pain, foot pain. The topical remedies that they sell at the stores are quite effective. I live in Colorado. There's studies going on now with part of this medical marijuana for leg pain, and so that's something that probably we'll hear more about as they understand better what types are effective for leg pain and foot pain. These electrical stimulating units are good. Acupuncture, like we talked about, can all be helpful. And chronic pain, most of the pain clinics give some type of prescription for a mood elevator, like an antidepressant, basically, because chronic pain wears on your brain, as we all know, and can change your mood and your affect. And so the more your power of positive thinking kind of thing can also help the pain, whether it's chemically induced positive thinking or whether you're able to do that through meditation and mindfulness. This is why I teach Nordic pole walking. Is we call it HOPE, healthy outdoor pole exercise, because it's for people who don't walk good and have pain in their feet and legs, and it helps to take stress and strain off them so that your body can function. And the more active you are, the less likely you are to have pain. It's one of those vicious cycles that I'm in pain, I don't want to exercise or be active, but then actually that makes the pain worse. So if you can get a little exercise, whether it be swimming or pole walking or whatever, then it does help to lower that pain. raise a lot of these internal hormones and chemicals that endorphins that help to make the body not aware of pain. Is that helpful?
Yep, very much so. And I think with that, we're at about 9:10 right now. I think that's the last question we'll have. I know that your information is up there on the screen for people if they want to contact you. They can do so. And of course, always the CMTA is there for everybody. And I'd just like to say thanks very much. I thought it was really interesting conversation and well-attended webinar. And I don't know if you have anything else you'd like to say there.
Well, I'm really grateful that we had such a good turnout, Bob. So thank you for moderating, and I look forward to the next one. So please keep a list of those topics you'd like to see on the next foot and ankle webinar. I appreciate it, and have a nice evening.
All right, thanks.